Hi, I'm Dr. Wu from the California Center for Reproductive Health. I am a reproductive endocrinology and infertility specialist and a mom of two. And today I wanted to go over some of the topics and questions patients have about making their first appointment with us. So first of all, what is a reproductive endocrinologist and infertility specialist, and what do we do? So an REI for short, not like the sports store. We are actually OBGYN trained physicians, so we actually take care of medical and surgical treatment for lots of disorders of female reproductive tract. We also received special training in a very competitive fellowship to actually learn how to assist women with advanced reproductive technology, including in vitro fertilization or IVF. IVF is actually not the only thing we do, however. We do take care of women for a lot of different reproductive issues. So women that have recurrent miscarriages, women who don't ovulate, and have other endocrine disorders. We also see patients, single females who might be interested in egg freezing, or women who are diagnosed with cancer who need to preserve their fertility so that they can have a future with a possibility of their own genetic child. And we also provide services for our LGBT community to patients that will want to pursue fertility with sperm donors or reciprocal IVF, where one female patient carries her partner's embryos. And then also we do third-party reproduction, so egg donation and gestational surrogacy. So one of the most common question is, when should I go and see a fertility specialist? So this is in general, after 1 year of unsuccessfully trying to achieve pregnancy, you should consider seeing a fertility specialist. Now, prior to that, you should be making a consultation with your own general OBGYN for preconception counseling, because they are able to at least start the process of going through your medical history, reproductive history, and see if there's anything that needs to be done earlier, or if you need to be seeing an REI specialist earlier, okay? Now, there are some caveats to this 1 year of trying. First, you do have to have regular cycles. So women that are not ovulating, not having a period every month, should be seeing their doctor earlier. Other women or couples who might be actually getting pregnant but having recurrent miscarriages shouldn't be waiting for a full year of trying before they see us, because there are evaluations that need to be done as soon as possible to help you achieve a live birth, okay? And then thirdly, another category of women are women over the age of 35. If you are over age 35, you really should be trying for about 6 months. And if you are not successful, you should be making an appointment for a consultation. And again, the 1 year is a general mark. I know patients have asked, is this 1 year of active trying? Every couple is different, and every couple's situation is different. So if you've gone through a year of unprotected intercourse with occasional intercourse once every week or once to twice a week, and even though it hasn't been active, I think that is actually enough of a length of time for you to have the evaluation. And again, the evaluation doesn't necessarily mean you need to go and have IVF. It just means you're making sure that you're optimizing your own fertility, natural fertility, and that you're kind of timing everything well, and that there isn't any outstanding factors that needs to be addressed. So even seeing a fertility doctor earlier, just to make sure that you have, the couple of months to try, makes sense for a lot of couples. So the next question, a lot of patients ask, what should I expect for my first visit? So the first visit, plan for about an hour, where we actually go through in depth your medical, reproductive, surgical history, okay? So a lot of times we'll start off with your general health, any surgeries that you've had, and then really can we focus down to your reproductive status, okay? So prior pregnancies, ectopic pregnancies, miscarriages, how long have you been trying? Then we go through your menstrual history, age of first menses, how regular are your cycles, Are your cycles getting shorter, longer? How heavy your flow is. Is it really light or is it very heavy? Is there any associated pain, cramping with your periods? And then also we go through any previous history of pelvic infections, diagnosis of endometriosis, uterine fibroids. Have you been on previous contraception before, like Depo-Provera injections or an IUD? All of these kind of factors into how and where your reproductive status is, okay? And then most of the times after the consultation in the office, depending on where you are in your cycle, we would recommend a transvaginal ultrasound. So this is a pelvic ultrasound and blood work. The pelvic ultrasound is really important because it gives us a really good idea, a snapshot of what your uterus looks like. So we're looking for any fibroids, polyps, and also what your ovarian status looks like. We can see your antral follicle count or your resting egg count for that month. And then additional blood work to check your hormonal status, okay? You don't need to have, so I mean, the blood work and pelvic ultrasound, some patients are not ready for it. It's more invasive, and if you're not ready for it, it's fine. But a lot of patients that come see us are now ready to take that next step to kind of do the full evaluation. So the next question we get a lot is, does my partner have to come for this initial consultation? And in general, even though it's not a requirement, I do like to have the partner involved early on in the workup. And this is because we do talk a lot about the physiology of reproduction, and there's a lot of information. So having an extra set of ears, or having a trusted friend or someone to come with you is really, I think, beneficial. For heterosexual couples, your male partner should be coming with you because we do also get a very thorough medical, surgical, and reproductive history from your partner. And so there are certain things that you might not know, if they've had as a child testicular torsion or something that could be a very significant impact on their fertility. So these are things that might come up, so they should be physically present. So another question patients have is, what if my partner's not ready for treatment? So I think in that case, you should still come for your evaluation, go through a consultation, we evaluate your ovarian reserve, and depending where you are in your life, you might consider egg freezing, and this is an option for you to preserve your own fertility so that you can make the decision in the future on what to do. So that gives you a little bit of an insurance that you will have your own fertility preserved in the future. Okay. Another question that a lot of patients think about prior to taking the first step to make an appointment to see a fertility specialist is whether fertility treatment is expensive, or whether insurance coverage covers fertility treatment. So in general, it really depends on each patient and their situation. So you might not need, the highest tier IVF treatment for your particular situation. There are less expensive treatments like inseminations, and that are right for you. So I don't want cost to be a big factor for patients to be hesitant about seeing us. And also, there are a lot of insurances now that do provide some sort of coverage for at least the consultation and the workup. So I think after our consultation, after we figure out what might be the best next step for you, one of our financial counselors will sit with you and kind of review kind of the financial packages that we do offer. So again, I just want to emphasize, not every treatment is expensive. So depending on your particular situation, a very simple treatment that's very affordable might be actually the best treatment option for you. And then during the consultation, a lot of patients ask, how soon can we start treatment? I think in general, again, we try to take each patient individually and their situation individually. Most of the times we do wait for your second or third day of your cycle to start your particular cycle, okay? But again, this can be dependent on where you are in your reproductive health, and we might be able to initiate treatment earlier. It all depends on your reproductive status. So I hope this video was helpful for you to have a general idea of what to expect when you make your first appointment with us. You know, the questions that come up often are a good way to kind of get started, but it's not, it shouldn't be taken as medical advice. So I think for patients that are interested in starting to build their family or have questions about their own fertility status and evaluation, please feel free to make an appointment. We do have more information in our link with different blogs and articles to kind of just get informed. And again, you know, we would love to see you in person or through telehealth if you want to make a video appointment. Okay. So again, I'm Dr. Wu from the California Center for Reproductive Health. I hope you enjoyed this small educational video. Please stay tuned. We'll be updating with more soon. Okay. Bye.